This is how to do a threshold check on a device that is programmed to VVI mode. I can tell it's VVI because it says so at the top. The pacing rate here is 50, which suggests that the VVI has been programmed as a backup mode of pacing for this patient. My voltage is at 8 volts. My sensitivity is at 2 millivolts, and I can tell that I'm mostly sensing. In fact, I'm 100% sensing by the green flashing light here. So to do a threshold check, I have to be pacing. So I am going to have to increase that pacing rate there from 50 to something above the intrinsic. So I unlock it, I move the rate up, and I'm just going to go straight to 90 beats a minute, but anything more than 10 beats above the intrinsic is good. I can tell that I'm now pacing because the yellow light is flashing. There's no green light anymore, it's the yellow light. So now what I have to do is to rotate the output and decrease the voltage. So I bring the voltage down, and straight away it measures the impedance, because the moment that I move that output control, I'm going to measure the impedance. And this said 545 ohms, which is fine, and that's covered in another video on impedance. So I'll keep coming down, 7, 6, 5. I'm coming down faster than I ordinarily would, but I'm coming down. I'm still pacing. There's no sensing. So come down to 0.9, 0.8, 0.7, still pacing, 0.6, and I lose capture at 0.6, and I can see that from the ECG. I can also see it from the box because I now have a green flashing light here. So I'm pacing and I'm having a green flashing light, which tells me I'm sensing the non-captured R waves. So that's obviously not the threshold yet, so I come back up, 0.7, 0.8, and at 0.8 I'm now pacing. Oh, still getting a sense beat. I'll come up a bit more, 0.9, 0.9, there we go. So now that's my threshold, is 0.9. So I set my output substantially bigger than that. You will see in some manuals a comment about setting output twice the threshold. Ignore that. That is incorrect, because you obviously wouldn't set the output to 1.8. Go all the way back to 8, and then just make sure that the 8 volts which you've chosen or selected, or use the default, but this value is substantially bigger than the threshold. Ask the checking question, is that more than twice the threshold? And of course it is. And that's the threshold done. We must remember, of course, if this was in backup mode, to put the pacing rate back down to 50 beats a minute.